Social determinants of health and their effect on perinatal mood disorders. Perinatal mood disorders include antenatal depression, postpartum depression, anxiety disorder, perinatal obsessive compulsive disorder, post-traumatic stress disorder, and postpartum psychosis. Perinatal mood disorders are a significant problem in the United States. Depression during or immediately after pregnancy affects approximately 1 in 7 women. Postpartum depression is associated with significant neonatal and maternal morbidity. Maternal suicide is a more common cause of peripartum mortality than postpartum hemorrhage or hypertensive disorders. There are associations between perinatal mental health issues and preterm delivery, low birth weight, impaired postnatal infant growth, insecure infant-mother attachments, and suboptimal breastfeeding practices. While there are biologic and hormonal risk factors that affect a woman's risk for postpartum depression, there are a number of social determinants, including socioeconomic status, race and ethnicity, and a lack of social support that influence a woman's risk of experiencing perinatal mental health issues and the likelihood that she will seek and receive adequate treatment. Fear of stigma can also prevent women from seeking care. However, even if a woman seeks care, she may not have access to the services she needs. Providing high-quality perinatal mental health services is particularly difficult in low-resource settings with limited health workforces. While the numbers surrounding postpartum depression are astounding, studies have shown that women of color experience postpartum depression at a rate of close to 38%, compared with approximately 13 to 19% of all postpartum women. Black women are half as likely to receive mental health treatment and counseling as white women, and are one of the most undertreated groups for depression in the United States. Another high-risk group for postpartum depression is immigrant women. Approximately 42% of immigrant women experience depression. Patient-centered care that is designed with cultural values and beliefs in mind is needed. Social support is evidence-based, with research showing that in-home visiting and telephone-based health promotion decreases depressive symptoms. This slide shows that a study that was done in Ontario regarding immigrant women not accessing postpartum mental health care. And the study shows that immigrant women are less likely to receive care that might prevent hospitalization for mental health needs in the first year after giving birth. And while they are less likely to access care, they are not less likely to be hospitalized. Authors say these findings suggest that immigrant new mothers may face obstacles to preventative mental health care, such as stigma, language barriers, associated costs, and differences in cultural norms. So how do we fix the problem? The following are some recommendations to better address postpartum depression and the social determinants of health. Support comprehensive health care coverage, including mental health services and maternity care. Improve access to culturally competent, well-trained mental health care providers for underserved communities, particularly single mothers, low-income women, women of color, and immigrant women. Support the integration of mental health screening into other healthcare settings for pregnant and postpartum women, as recommended by the USPSTF. Fund large-scale, culturally appropriate public education campaigns that help women recognize their symptoms and empower them to seek the help they need. Conduct additional research on perinatal mood disorders, taking into account the lived experiences of women of color, and include information on the immediate and long-term impact on both women and children of color. Develop policies and education campaigns that take into account the lived experiences of pregnant and postpartum women of color, as well as the ways that racism and gender discrimination impact their mental health and well-being. And educate healthcare providers, patients, and communities about the importance of access to and utilization of mental health care among women of color. Finally, we need to support policies that would improve work-family balance for women in the workplace, including the expansion of access to paid sick days, paid family and medical leave, and fair scheduling.